Digging into startling statistics, anxiety disorders up 94%, major depressive disorders up more than 84% in the past year when it comes to our teenagers. During COVID lockdowns, teenagers intentionally harming themselves up just shy of 100%. And listen to this. In the Northeast section of the United States, there was a 333% increase in self-harm medical claims for kids between the ages of 13 and 18. Many are sounding the alarm, saying we have to make a change. Dr. Hillary Blake is a child psychologist with Riley Hospital for Children. She's joining me now with some help and some answers. So good to see you. This is so important. We've been talking about mental health, but are we talking about it enough? What do you say and what do you think, just kind of to start this off?
Yeah, I think mental health discussions are more important than ever right now. I think we're not talking about it enough. As we are probably well aware, there's a lot of stigma around mental health across the United States and other countries too. So a lot of people aren't talking about this with their kids or among each other. You know, I think when we're talking about the pandemic, when we ask, oh, how are you doing? And things like that, people give this false, oh, I'm doing okay. But we aren't asking people, how's your mood? How's your anxiety? How are you coping with this? Those aren't questions we're asking each other at this point in time.
Fair Health Study is who put this study out with all of those statistics. We're going to have a link to our website for people who want to see that. I want to give people specifics, though. You know, there are probably a lot of people watching right now, whether it be a parent, a grandparent, an aunt, uncle, maybe a student themselves, who started cutting themselves this year. Maybe they're struggling, having anxiety, panic disorder, severe depression. You have a specific treatment that you really want to talk about today, DBT. Who is that for and what is that?
Yeah, so dialectical behavioral therapy, or DBT, is the gold standard treatment for individuals who self-harm or cut. So we do have data that suggests you can use it for other disorders too, but with the astonishing data that you just discussed, which honestly isn't a big surprise of what we are seeing here, that is what we want people to do. And so in that treatment, you have an individual therapist, and then you do skills training with a group, where you learn skills for emotional regulation, communication skills, you learn distress tolerance skills, you learn mindfulness, and then you learn skills to help the parent and child interact better. So that is kind of the gold standard that we're shooting for these populations.
So important. I'd never heard of that. And Hillary, I think that schools, you know, some aren't in session. My kids have been in school all year. We only have a minute left, but do you feel like this is a conversation that we need to be having more, maybe even having a class, more educating our kids about these things and where to get help and what it is and what you're feeling?
Yeah, 100%. I think these are conversations we need to be having more in schools. I think right now it's hard with the hybrid situation. You know, it's harder to have access to school counselors and have those discussions. You know, it's harder to have groups at schools and things like that. So it's definitely impacting our teens.
Dr. Blake, child psychologist with Riley Hospital for Children. I know we're only scratching the surface here, but thank you so much for being with us. And I'd like to have you back on sometime to talk more about this. And if you would like to read that entire Fair Health Study, we have it linked, talking about the impact of COVID on our children and, you know, loneliness too. You'll find a link to it at fox59.com/Angela Answers.